Physical activity basics in obesity management. Physical activity is a fundamental component of obesity management, contributing not only to weight loss but also to the maintenance of weight loss, improvement of overall health, and reduction of obesity-related comorbidities. Understanding the types, benefits, and recommended levels of physical activity is crucial for developing effective treatment plans for individuals with obesity. The role of physical activity in obesity management. Physical activity is any bodily movement produced by skeletal muscles that requires energy expenditure. It is a key element in energy balance, which is the relationship between energy intake, calories consumed, and energy expenditure, calories burned. For individuals with obesity, increasing physical activity can help create the necessary caloric deficit for weight loss, as well as improve cardiovascular fitness, enhance metabolic health, and support mental well-being. Energy expenditure. Energy expenditure consists of three main components. 1. Basal metabolic rate, BMR, the amount of energy the body uses at rest to maintain vital functions, such as breathing, circulation, and cell production. BMR accounts for approximately 60 to 75% of total daily energy expenditure. 2. Thermic effect of food, TEF, the energy required to digest, absorb, and metabolize food. TEF contributes about 10% of daily energy expenditure. 3. Physical activity. This includes both exercise and non-exercise activity. Thermogenesis, NEAT. NEAT refers to the energy expended for everything we do that is not sleeping, eating, or sports-like exercise, such as walking, typing, or gardening. Physical activity is the most variable component of energy expenditure and the one most directly influenced by individual behavior. Increasing physical activity can significantly boost daily energy expenditure, thereby aiding in weight loss and preventing weight regain. Types of physical activity. Physical activity is broadly categorized into aerobic, endurance, activity, anaerobic, strength, activity, flexibility exercises, and balance training. Each type has unique benefits, and a well-rounded exercise program should incorporate elements of all four. Aerobic activity. Aerobic activity, also known as cardiovascular or endurance exercise, involves continuous, rhythmic movements that increase heart rate and breathing. Examples include walking, running, cycling, swimming, and dancing. Aerobic exercise is effective in burning calories and improving cardiovascular health, making it a cornerstone of obesity management. 1. Moderate intensity aerobic activity includes activities such as brisk walking or water aerobics, where individuals can talk but not sing during the activity. 2. Vigorous intensity aerobic activity includes activities such as running or swimming laps, where individuals cannot say more than a few words without pausing for breath. Anaerobic, strength, activity. Anaerobic activity, or strength training, involves exercises that use resistance to induce muscular contraction, leading to muscle building and strength improvement. Examples include weightlifting, resistance band exercises, and bodyweight exercises like push-ups and squats. Strength training is essential for preserving lean muscle mass during weight loss, which is crucial because muscle tissue burns more calories at rest compared to fat tissue. Benefits of strength training: increases muscle mass, boosts metabolism, improves bone density, and enhances functional fitness, which is the ability to perform daily activities. Flexibility exercises. Flexibility exercises include activities that stretch and lengthen muscles, improving the range of motion around joints. Examples include yoga, Pilates, and specific stretching exercises. Flexibility is important for preventing injury, maintaining mobility, and improving overall physical function, especially as individuals age. Balance training. Balance training involves exercises that improve stability and coordination, which are important for preventing falls and enhancing overall movement efficiency. Balance exercises are particularly important for older adults but are beneficial for individuals of all ages. Non-exercise activity. Thermogenesis, NEAT, refers to the energy expended for all activities other than sleeping, eating, or structured exercise. This includes activities like walking to work, gardening, doing household chores, and fidgeting. Increasing meat can significantly contribute to daily energy expenditure and is an important component of overall physical activity, especially for individuals who may not be able to engage in structured exercise due to time constraints or physical limitations. Recommendations for physical activity. The amount and intensity of physical activity required for weight loss and maintenance vary depending on individual factors such as age, fitness level, and overall health. However, general guidelines provide a useful starting point for most people. 1. For weight loss, moderate intensity activity. The American College of Sports Medicine (ACSM) recommends at least 150 to 250 minutes of moderate intensity aerobic activity per week to prevent significant weight gain. For weight loss, more than 250 minutes per week may be necessary. 2. Vigorous intensity activity. Alternatively, 75 minutes of vigorous intensity aerobic activity per week can be effective, though combining both moderate and vigorous activities is often recommended for optimal results. 3. Strength training. At least 2 days per week of strength training exercises that involve all major muscle groups is recommended. Strength training helps preserve muscle mass during weight loss and increases resting metabolic rate. For weight maintenance, after weight loss, maintaining physical activity levels of 200 to 300 minutes per week of moderate intensity aerobic activity is recommended to prevent weight regain. Benefits of physical activity beyond weight loss. While weight loss is often the primary goal of increasing physical activity, the benefits extend far beyond shedding pounds. Regular physical activity has profound effects on both physical and mental health, contributing to overall well-being and quality of life. Physical health benefits. 1. Improved cardiovascular health. Physical activity strengthens the heart muscle, improves circulation, and reduces the risk of cardiovascular diseases such as hypertension, heart attack, and stroke. 2. Better glycemic control. Regular exercise helps regulate blood sugar levels by increasing insulin sensitivity, which is particularly important for individuals with or at risk of type 2 diabetes. 3. Reduced risk of chronic diseases. Physical activity lowers the risk of developing chronic conditions such as type 2 diabetes, certain cancers, e.g., breast and colon cancer, and osteoporosis. 4. Enhanced metabolic health. Exercise improves lipid profiles, reducing levels of LDL cholesterol and triglycerides while increasing HDL cholesterol, thereby lowering the risk of metabolic syndrome. 5. Increased longevity. Active individuals generally live longer than their sedentary counterparts, with a lower risk of premature death from all causes. Mental health benefits. 1. Improved mood and reduced anxiety. Physical activity stimulates the release of endorphins, which are natural mood lifters. It also reduces levels of stress hormones like cortisol, helping to alleviate anxiety and depression. 2. Enhanced cognitive function. Regular exercise has been shown to improve cognitive function, memory, and concentration. It may also reduce the risk of developing neurodegenerative diseases such as Alzheimer's. 3. Better sleep. Physical activity can help regulate sleep patterns, leading to better sleep quality and duration. Social and psychological benefits. 1. Increased self-esteem. Achieving physical activity goals can boost self-esteem and body image, contributing to a positive self-concept. 2. Social interaction. Group activities and sports provide opportunities for social interaction, which can enhance motivation and enjoyment. Overcoming barriers to physical activity. Despite the well-documented benefits of physical activity, many individuals face barriers to becoming more active. Common barriers include time constraints, lack of motivation, physical limitations, and environmental factors such as unsafe neighborhoods or lack of access to exercise facilities. Strategies to overcome barriers. 1. Time management. Incorporating short bursts of activity throughout the day, such as walking during lunch breaks or using stairs instead of elevators, can help individuals meet their activity goals. 2. Setting realistic goals. Starting with small, achievable goals and gradually increasing activity levels can build confidence and create a sustainable exercise routine. 3. Finding enjoyable activities. Choosing activities that are enjoyable increases the likelihood of adherence. Whether it's dancing, hiking, or playing a sport, enjoyment is key to long-term commitment. 4. Social support. Engaging in physical activity with friends, family, or groups can provide motivation and accountability, making it easier to stay active. 5. Adaptations for physical limitations. Individuals with physical limitations can benefit from modified activities, such as chair exercises or water aerobics, which reduce strain on joints while still providing cardiovascular and strength benefits.